the same country and we come from the same hospital, we decided to make one common presentation, multidisciplinary, okay guys? So it will not have much information about us. We will talk more about the hospital and the system in Kyrgyzstan.
How do I make it like? Is it working?
This one. This one.
Yes.
Which one? This one? This one?
Yes.
Okay. So I have to apologize first for not having a good presentation because we were not prepared well. Back then when we were in Kyrgyzstan, we wanted to prepare a nice presentation, but Professor Peter told us that we have to include some information about Korea also. So we decided after we arrive, we will add some pictures from Korea also and talk about our Korean experience. So here we did not think that all the computers will be in Korean. So we had a challenge to make a presentation. So we did it on tab, which had, some shortage of the possibilities to do well presentation. So we will talk about our microsurgery journey from Kyrgyzstan to Korea. There were 3 visitors. Apiev Kanat, he's a senior. He already left the country on 26th of April, and right now he is actually the National Hospital of Kyrgyz Republic with a team from Korea. Professor Peter, Professor Han, and resident June, yes, went to Kyrgyzstan to perform some surgeries. Also me, my name is Meerim, and Aleksandr. So we'll talk a little about ourselves. So if we talk about Kanat, he was our senior. He was a doctor when we were residents. There is some information about the background that he has. Right now he works as an attending doctor in the National Hospital of Kyrgyz Republic, which is the biggest central hospital in Kyrgyzstan. And actually the department is called Hand and Foot Microsurgery, Plastic and Reconstructive Surgery department. And it is actually the only department in Kyrgyzstan that does the reconstructive surgeries. So some information about myself. I just recently, this information is a bit old. I just recently graduated from I finished my residency. So right now I work at the private hospital. I just started, so I did not include much information about that. And also in my background, I actually first went to the residency of general surgery and then decided to change my field to the plastic surgery.
This is about me. My name is Aleksandr. I am last year resident of the plastic surgery. Previously, I worked as dermatovenerology 5 years. Okay.
So he also decided to change his field to plastic surgery. Next, this is our institution where we all study. Now I want to tell you a little bit of difference between Korean education system in medicine and in Kyrgyzstan. So from what I know, the Korean education system in medicine includes the steps like the medical school, then the internship or residency, internship, then residency, and then fellowship, right? So a lot of steps, not like in Kyrgyzstan. We have a shorter way. We have to pass 6 years of the medical institution, of medical university. Then we go for internship, residency, and that's it. No fellowship, no anything like that. So residency is the last step. Then we can go ahead and be attending doctors.
Fellowship is not mandatory.
Oh, really?
If they want
Oh,
to, they can do a fellowship.
I thought it was a mandatory thing. And the system of getting like PhD is a bit different. We don't have such a thing as PhD. You become a professor, but in a different way. I mean, it's not like in Korea. We have to go to the institution, study for 5 years, and then you have to make some kind of research, and then you get the... you still will not become a professor. You'll be like a candidate. And then after some time, after some other things, you can become a professor. So it's a lot tougher way to become a professor. Next. So where is Kyrgyzstan? A little information about our country. It's a small country, mountainous country, located in the Central Asia, which mostly consists of mountains. About 90% of the landscape is mountains, mainly in the Tian Shan mountains. So it is bordering with countries like Kazakhstan, Uzbekistan, Tajikistan, and China. The biggest border I believe we have with Kazakhstan and China. And official languages are Russian and Kyrgyz. So everyone is bilingual from the beginning. So these are some landscapes from our country. I hope that you will see these pictures and would like to visit sometimes the Kyrgyzstan. It's a very touristic place and it's very beautiful, and it's just starting to develop in a touristic way. So the nature is still, not touched. So these are some landscapes. Actually, that picture I took myself. It is from the village from where my ancestors come from. And some more pictures. So we have very different landscapes. We have some lakes, we have mountains. You can see a lot of woods. So different landscapes. These are some pictures of our traditional dresses and traditional home called yurt. And we are a nomadic country. So previously, by the history, we used to live somewhere in Russian territories now, near Yenisei River, and then we moved to the Central Asia. So still part of Kyrgyz people who do the farming and the mostly not farming, the work with animals. They go to the mountains during the warm season, and during winters they come down to the to their homes. So this is our capital of our country, Bishkek, and it is actually surrounded by a mountain, so you get a very beautiful view every day. This is our Ministry of the Health in the Kyrgyz Republic, which is very small, not funded well. That's why you can get an idea about the state of medicine in Kyrgyzstan, which is not very well because it's not well funded, it's not developed, and most of the instruments and everything is very old. Also, the facilities are also old. This is our department and people who work at the department. Our chief at the center in the blue, Rustam Tobodzic, maybe you remember him. He visited last year. And you can see Aleksandr and me and Kanatbek on the picture. So these are some pictures from our department. So we don't do dressings at the bed like you do it here. We have a special room where we do the dressings. It's on the first picture. I guess it is because in our country we have the old Soviet Union system, where it is believed that for everything you should have a separate room because it's easier to keep the the wound cleaner and everything like that. The second picture is one of the rooms where patients stay, and the next picture is for OPD. So this is a picture actually that our Korean colleagues took last year when they visited Kyrgyzstan. We went to visit our patient in the after surgery, and this is the microscope that we have, and this is the OR. And actually, we do like here mostly you don't do the emergency cases. In Kyrgyzstan, half of the cases, maybe even more than half of the cases, are the emergency cases because we are still a developing country, which has a lot of constructions and building the different kind of places where you can get a trauma. So in most of the cases we get traumas like this, the tendon traumas, nerve traumas, the amputations. These are some examples. And we do flap surgeries also, but not that much, and sometimes they fail. So these are also some examples. We did not use the NPVT system before. We got a chance to meet our Korean colleagues. So Professor Peter was kind enough to give us the NPVT system, and we found it very useful for the lot of cases. For example, this boy, he was actually our patient when I was a resident of Kanatbek, and he got a trauma, like the bone was exposed, and it was a very bad case. The other surgeons were talking about, like the orthopedic surgeons were talking about the amputation, maybe. So, but we actually saved the leg. And he stayed in the department for like 1 month because of that. At the end, we put the skin graft on the top. And these are some pictures from last year when our Korean colleagues visited us. So we had a very good time having professional cooperation, also having some rest and taking them to different places. And we also had the presentation from our Korean team. And also we enjoyed our experience in Korea. So this is the picture from the first day when we arrived. This was our first party with Team A. And we find Korea to be a very hospitable country, very friendly, and we've never visited so many parties before. So it was a lot of fun, very educational also. We saw a lot of surgeries. We had a good chance to see the surgeries before when Professor Peter's team visited us, but seeing it in a different hospital with a different system, it's also an interesting experience because we got to compare like our systems and what we have to work on. And I would like to thank you for your attention, and please if you have a chance, visit our congress that will be held on 8th and 9th of August this year. It will be our 3rd international congress, which will be held in Bishkek, Kyrgyz Republic. So if you will have a chance, please visit us.